Good evening, everyone, and welcome to the Scleral Education Society's August webinar. Excuse me. It is my pleasure to welcome and introduce Dr. Manveen Bedi, who will be giving us a wonderful talk about navigating the Scleral journey, optimizing patient experience, and staff integration. Dr. Bedi pursued her doctorate of optometry in Chicago and her residency in cornea and contact lens in California. Dr. Bedi's optometry practice focuses on specialty contact lens fitting for corneal pathologies, management of dry eyes, and myopia control. She is passionate about teaching, has authored several articles, and presented at several local optometry societies and universities. She is a fellow of the Scleral Lens Education Society and also a fellow of the American Academy of Optometry. Welcome, Dr. Bedi. All of her financial disclosures would be listed here. If so, they have been mitigated. Just a little bit about the webinar and how it's structured for this evening. So there is a Q&A feature and a chat feature. So please feel free to put your questions in either one of those features. I'll be monitoring both of them. At any point during the webinar, if you have a burning question, just put it there, but we will be reserving questions for the end of the webinar. In order to get COPE credit, CE credit, you must remain online for a minimum of 50 minutes. Attendees are welcome, but not obligated to stay for the Q&A at the end. Course handouts will be available on the SLS website library page at the conclusion of our webinar this evening. Just a little bit about the OE Tracker app. If you haven't attended one of our webinars, you may not be familiar with this, but if you are, I'm sorry to repeat it every time, but you have to download the OE Tracker app in order to be able to scan the QR code at the end. You can't just scan the code. So in order for the code to work, download the app, open the app, verify that your personal information is correct, and then touch scan QR code. Your camera will open, and then you will be able to scan the QR code and get instant CE credit that way. If this is not your thing, don't worry about it. You will be emailed a certificate within 2 weeks. All right, Dr. Bedi, I will be turning it over to you.
Thank you so much for the introduction. Let me share my slides so we can get started. Perfect. Are you able to see the screen? Good.
Yes.
Well, thank you so much for coming and attending the lecture today. So the topic of today's discussion will be navigating the scleral journey through the patient's perspective and optimizing their experience, as well as using your staff to streamline the care that we are providing to our patients. So a few objectives that we'll discuss in the lecture. First, we'll understand the patient challenges. We'll look into different strategies by which we can improve adaptation to the contact lenses. We'll talk about common patient concerns that arise during the consultation or the fitting process. We'll look into strategies of how we can maximize or enhance the communication and teamwork between our staff members to streamline patient care. And lastly, we'll focus on using our staff members and training them across different roles so that we can optimize that whole experience for our patients. So before we begin, I wanted to touch base on the basics and foundation of the scleral lens before we move into the patient journey. So we all know that for scleral lenses, these are your typical large diameter contact lenses. So essentially, we're looking at them as a prosthetic device that can provide that large diameter protection on the ocular surface. It has the added advantage of having that tear reservoir that's built into it that can help or be an aid for patients who have dry eye pathologies. And lastly, when we are talking about scleral lenses, there are ideally two different populations that we are fitting. We're either fitting scleral lenses for the purpose of visual rehabilitation or ocular surface disease protection. So there was a study that was done, that was the SCOPE sort of study that looked at the trends in scleral lens fitting practice. And they noted that 84% of the times when we're fitting scleral lenses, we're fitting it for the purpose of patients who have corneal irregularities and for the purpose of restoring the vision for those patients. Then we have our subset of patients, like 10% of patients that we are fitting for dry eyes or severe corneal surface diseases or neuropathic corneas. And then there's that minority where we're fitting it for just the uncomplicated refractive errors. So when we look at the scleral lenses, they have a lot of advantages in comparison to our traditional lenses. So first, we know that they're large diameter, so they provide that larger surface area that they can cover on the eye. And this is essential for patients who have dry eyes or just chronic ocular surface disease. The larger area that we can cover and protect, it aids in their therapeutic. It provides a therapeutic advantage for those patients. The second advantage is that lubrication, that tear reservoir that's built into the lens. So your cornea is continuously being hydrated, and there's that protection that we are also adding. And lastly, the comfort of a scleral lens. The lens has minimal lid interaction, so there's just more comfortable from the get-go for patients. So now we know that it's a great option for both visual restoration as well as for providing that ocular surface protection for our patients. But what exactly does that mean for our patients in the clinical settings? So when we look and when we try to break down that journey of a patient who's gone through the diagnosis process of just being diagnosed with keratoconus, some sort of a chronic condition, and now is going into the clinic, there's multiple things that happen along the journey that we need to be mindful about. So if you were to start, we start with number one, which is the trigger. So essentially, in cases where we're discussing, for instance, a patient who has keratoconus. So a trigger might be the symptoms of having blurry vision or halos or glare that they might be experiencing that may cause reduced visual output for that patient. That results in the patient kind of going on Google or researching their symptoms or just having discussions with their family members about the trouble that they're experiencing with their vision. And that might trigger the stage of like scheduling your appointment, of going and getting the diagnosis for the condition. Then we are looking into the treatment stage, and that could be multifold. It could be a treatment, for instance, of cross-linking for a young child who's just gotten a diagnosis of keratoconus, just to stabilize that corneal surface, or it might mean a graft for some people who've gone through an episode of eye drops or severe scarring, and now we're looking at the therapeutic stage of actually getting that cornea treated prior to initiating the management with the lenses. Condition management would entail your scleral lens so that we can manage that condition on a long-term basis because these patients will have those chronic conditions. And lastly is treatment adjustments, which is the modifications that take place on an ongoing basis. So one of the key things when we're looking at the patient journey is always one of the important themes that always arises is the disconnect that happens between the patient and the practitioner at the stage of diagnosis. So this was one of those studies that actually focused on patients who were given a diagnosis of chronic obstructive pulmonary disease, so COPD diagnosis. So in this particular article, they looked at this stage of diagnosis and what exactly was being relayed to the patient and what was the information that was retained by the patient. So if you look to our left, we can see that in this instance, we're looking at what is the information that the physician is passing on to the patients. So we're looking at that the physician's pretty much telling patients that the conditions related to smoking, they should quit smoking. There is the medication to control the symptoms. They're providing what the diagnosis means. So there's a brief discussion about the diagnosis, what it means in terms of loss of lung function, the fact that the illness is chronic, there's no cure, and it may get worse. And then if you look onto our right side, we can see the information that is being retained by the patient at the end of that diagnosis appointment. So they understand that they have a diagnosis of COPD, so that the word has been used or the terminology has been used. They understand that it's related to smoking and they should quit. That's the advice that they were given at the diagnosis stage. And they also know that there was a medication that was prescribed. But now if you look at what the diagnosis means, the loss of lung function, and all these different details, that wasn't retained at that appointment. There have been several studies that have shown that at that stage, there's almost about 40 to 60% of retention of information that the patients have after the diagnosis stage. So if you were to dwell deep into what the barriers are in terms of understanding and then acceptance of the diagnosis, we'll see that there are multiple different reasons for why that happens. And the first barrier is just the emotional impact that the diagnosis has on the patient. So this was another study that was done for patients for elderly patients who were going through memory clinic, and they were given a neuropsychological assessment for the diagnosis of dementia. So over here, the main key findings that they noticed for just the lack of acceptance or just having barriers to understanding of in terms of the diagnosis, one of the barriers was the lack of knowledge utilization. And that meant that the information that was being presented was not being understood. So there's overwhelming amount of information that's presented to the patient at the stage of diagnosis. However, if the information is not understood or it's not simple enough or presented simply or in a layman term, that information cannot be retained or it's then later on used towards the acceptance of the diagnosis stage. The second theme that came out of this paper was the emotional response, the distress that the patients go through, the uncertainty that the patients go through. So when a patient is going through the symptom stage of experiencing the symptoms, they've gone online, they've researched their symptoms, there's those unanswered questions, there's the fear of unknown, there's a fear of getting a chronic diagnosis and what that means for the patient in the long term. If you were to translate that into the diagnosis of keratoconus, for instance, we are looking at the fear or the anxiety that gets provoked with the chronic diagnosis of keratoconus. The fact that it can progress for patients, their vision can get worse over the long term, and what exactly are the different things that they can do to slow down the progression or how they can restore their vision. So there can be those unanswered questions that the patient might have at that stage. And that can also stop the patient from engaging in that diagnostic appointment with the physician. Now, when we talk about what can we do in this stage in terms of improving lowering those barriers and improving understanding, one of the things that the paper presented was putting the information out simply. So when you break the information down into simple terms, it's easy for people to understand and then retain that information. And another theme that came out was getting to a definitive diagnosis for the patient. So sometimes there can be a gap between the stage of having those symptoms to the time when the patient is diagnosed with testing and the diagnosis is solidified. And that can lead to much more uncertainty and anxiety. So reducing that stage between the symptom to the diagnosis can also aid in terms of the therapeutic advantage of having the patient understand their diagnosis and then accept the diagnosis. So if you were to break down the patient journey, that especially when they go through with the keratoconus or corneal irregularity diagnosis, we can see that there might be these different stages that they might go across. First will be the diagnosis stage, where they're being told that there is a chronic illness. The second would be surgical intervention, especially if it's a young child and we are considering cross-linking prior to initiating that fit. Then we're looking at the specialty contact lens fittings. So that will entail your consultation visit, the fitting visit, and then the future follow-ups and the ongoing care that the patient needs. And this is the stage of specialty contact lens where we can incorporate staff in their maximal capacity to improve and streamline the care that we are providing to our patients. So we now understand that there are certain barriers that the patients might face in their journey of getting the diagnosis and going through the healthcare process. So how can we as physicians get involved and help in terms of improving their understanding and bring them to a stage where there's acceptance of diagnosis and providing the therapeutic advantage with the scleral lens management? So one of the things that I always rely on is understanding how people learn, and that always helps. So if you were to break down in terms of what are the 4 essential learning styles that we see that are very prevalent in today's age, one is people who are visual learners. So people who prefer to learn through graphics, pictorial representation, charts, graphs. So one is attacking that particular style of learning by providing those resources to patients so that they can understand the diagnosis and the process that they're going to go towards. A second kind of learning skill would be auditory learners, people who learn through spoken language or through lectures, having those verbal discussions with the patients. That might be very, very good feedback for them to understand the diagnosis. Then we have reading and writing. So people who prefer to either make their own notes or write their questions down so they can ask more things, or people who prefer to just read from like pamphlets, brochures, just informational material. And lastly, we have our kinesthetic learners. So people are hands-on learners. So these are patients who prefer to perform a skill and then they learn best through that particular strategy. So the key tips that we can keep in mind when we are going through and breaking a diagnosis to a patient is first, simplify your language. Instead of using medical jargon that might be difficult for patients to digest, to understand, it's important to use simple language that they can understand. For instance, if you're talking about keratoconus, rather than saying that it is this degeneration of your cornea that can result in corneal irregularity, if you were to use words like, this is a condition where your cornea, instead of being more spherical, more round, has become more cone-like. That is something that patients can understand much better. Second is less is more. We need to understand that at the diagnosis phase, when the patient comes in, there is a fear. They already know that they're experiencing certain symptoms, that when they're going through the visual acuity testing, there might be frustration that they're not able to see the words. So there is that anxiety, fear that's built in already when they're coming and presenting to us. When we are presenting the diagnosis, focusing on 2 to 3 main points, keeping it succinct, might actually help the patient in understanding their diagnosis better. We have to realize that if only 40 to 60% of that information is going to be retained after that visit, presenting points in a much more focused approach will be ideal in that setting. And lastly, a picture is worth 1,000 words. Providing more graphics, visual representations, pulling up an image that can explain what you're actually trying to verbalize might be much more easier for them to understand and digest. So how do we integrate these learning styles and these tips that we've just discussed in our clinical settings? So at the stage when the patient presents to us for a diagnosis and when we're discussing our surgical intervention, there are 2 things that we need to focus on. First, the emotional impact of breaking bad news to the patient and understanding that having less is more is very important, and providing much more succinct advice to the patient will be ideal. In order to address that, I also prefer to have a friend or a family of the patient in the room. So while I'm discussing the diagnosis, I know that there is a second person who's also listening into the conversation, who's also absorbing that information on behalf of the patient, so that there's 2 sets of ears instead of just one. And secondly, understanding how can we improve that processing of information for the patient. So if you're trying to improve that information processing for the patient, how do we go about it? One of the strategies to improve that retention will be first, verbally explaining the diagnosis to both the patient and their friend or family who's in the room. That provides them the auditory feedback of learning about their condition and understanding the condition. In addition, kind of tag teaming that with written information in forms of brochures or just some handouts that they can take home and then take a day or 2 and then can read up on that information is quite useful. They have this concrete piece of paper that they can go back and use as a reference point to learn more about their condition. And lastly, just having that tailored approach of targeting the patients towards these credible resources or support groups. So that way we can prevent the online Google and access of Dr. Google. That can always be good in terms of ensuring that your patients are going to legit sources that are credible and that will have good information for them. So what I mean by that, like in our clinic, in the last 16 months since I've started my private practice, these are some things that I've kind of built on. So one of the things is having brochures. And when the brochures are presented, they have a lot of pictures, they have a lot of charts, and they have a lot of color. That always attracts patients. It makes it easy to present information, and it's easier for them to retain that information. The second thing that we'll add is we'll provide them with links and resources that they can go to at their own time and research their condition. So National Keratoconus Foundation, Living with KC, Canadian Keratoconus Foundation, all these websites, they have a wealth of information about keratoconus and so on. If like there is a diagnosis of ocular surface disease, then referring the patient to those appropriate channels that where they can find not just good information, but support group and resources for themselves is quite important in that beginning stage to make sure that there's a targeted approach that patients will take after they leave your clinic. In terms of the consultation for scleral lenses, I always prefer to tease those two appointments apart. So the first appointment is only for diagnosis and discussion of just any surgical interventions that might be needed. The second part of the puzzle is then dwelling deep into the scleral lens consultation. The consult itself acts as a follow-up visit for the patient, where if they had any questions that were left unanswered from the consult or the diagnostic visit, they can bring those questions to the consultation. We can address them throughout the whole discussion and make them feel listened and addressed, all their concerns to be more addressed. So when we're looking at the consult, there are a couple of different goals that I have during the consultation session. First is understanding the candidacy for lens. Like, is there a specific type or technology of lens that we'll be using for the patient? During this visit, I always like to apply the contact lens on the patient's eye. It's always been a much more positive experience for the patients to have the lens on, to see how it feels, to have the lens. It becomes less daunting. When you're showing them a lens on a suction cup, it can be quite intimidating for a patient, especially someone who's never worn a contact lens ever, to see a large contact lens that they will have to put on their eye eventually. But when you apply on the lens, show them the vision that they can achieve with the contact lens, the comfort of the contact lens, suddenly it becomes less daunting and less intimidating. Also, the input of just being able to see clearly, it always brings a smile to the patient's face at that point. And then lastly, just discussing the fitting goals as well as expectations of the fit. That is one of the crucial pieces of the consultation. So what I mean by establishing goals is understanding the underlying pathology for which we are doing the scleral lens management. Is the primary goal of the treatment vision correction? Is it an irregular cornea with reduced visual outcomes that we're trying to manage? And if so, are we looking at more of a generic scleral lens fitting from the trial set, or are we looking at more technology-driven scleral lens fitting, such as correcting for those higher order aberrations, and then also managing expectations? Sometimes when patients present, they might have dense scarring. So there might be that limitation of vision that the patients might have. So having clear expectations about what the final visual outcomes would look like, how the process will take, is very important. The second aspect is, are we treating the ocular surface disease with scleral lenses? And then having those open and honest discussions about the ongoing ocular surface management that still will need to be done in order to manage that chronic condition. So that's a very important piece. In addition, during consults, it's always important to kind of start addressing the history of the patient. So first is like looking at allergies, especially when you're working with patients who have keratoconus or all these irregularities. Allergies might be very, very common in that population. So ensuring that before we are ordering our lens and we are going to that first dispense visit, we are treating that underlying condition so that the surface is much more healthy and more optimal for the fit at the dispense. It's always important. It actually helps with with the successful outcome with scleral lens fitting. The next thing we're looking at is the history of contact lens wear. If a patient's previously worn contact lenses, even though it might be a soft lens or a different lens modality, that reflex of going close to the eye and not having, like, not squeezing your eyes shut is much more minimal or more controlled than a person who's never worn a contact lens. Sometimes in clinic, I'll see patients when we are applying the lens during the consultation, they'll just flinch and they'll squeeze their eyes shut. So at that point, I already know that we have to do more homework and prepare the patient before even the dispense or the application and removal training happens. So they have a more successful training session and there is less frustration at that session. The next thing we're looking at is their needs, like their lifestyle, their job. A person who's working in a construction site being already prepared with like what they will need visually, apart from just the lens in terms of safety glasses to ensure there's no surface scratches or foreign body being embedded within the lens, versus a patient who's presbyopic and we are fitting a lens, understanding that they might need a pair of reading glasses along with the scleral lens. So that way you're not just optimizing their vision far away, but also correcting that near distance or computer distance. So you don't get that complaint of, doctor, I can see with these lenses far away, but I can't see anything up close. So you want to minimize and you want to think ahead to minimize those concerns. And lastly is expectations in terms of visual expectations, in terms of follow-ups, of how the process will look like. That's always important. And lastly, we're looking at manual dexterity. In terms of dexterity, like sometimes we'll have patients who might have tremors and they might have difficult time handling the contact lens. So prior to your dispense visit, organizing tools that might actually help with trainings becoming more successful might be good. There's a lot of different scleral lens applicators that are out there, and so we can rely on the appropriate tool for the patient at the training session. At this stage, if the patient is agreeable and the consult goes well, you're going to the next step, which is proceeding with the fit. So this is where the consent forms will come into play. And this document will essentially be a long document where we're highlighting every single thing that we've discussed at that consultation. We are going to talk about our fitting goals that will be very well documented. There will be these options of alternate vision correction. For instance, if a patient has some good usable vision, we can talk about having a backup pair of glasses or what are the alternates that we can offer to the patient. There's your risk and benefits that we're going to cover. We're going to talk about the complications that can happen and the benefits and just see how they kind of outweigh each other. Then there's the warranty of when the fit is being started and how much time there will be allotted to the fit in terms of finalization of the contact lens. Then there's the replacement schedule of the lens. So the patient's already aware of the annual modality of the contact lenses so that they know that that will be an ongoing process for reassessment and then monitoring the corneal health. And lastly, the future directives about just the continuity of care that's required with the scleral lens fitting. When we go into the fitting process, here we're looking at the lens modifications, and the process is quite time consuming for the patient and requires effort in terms of having those fit changes and having a lens finalized that's more optimized to their scleral anatomy. And then the next thing that we're training patients on is the surface health of how to maintain the contact lens surface health to ensure that the longevity of the lens is maintained. There's less scratches that develop on the body of the lens, the disinfection process is right, and just all the precautions that come with wearing a contact lens. In this stage, when we are talking about the fitting and modifications, we also need to understand from the patient's perspective that there's a lot of expectations that we have. First, it's a new skill. Like if a patient has never worn a contact lens, graduating them to a scleral lens can be quite a daunting task. There's a lot of different moving parts that are involved in the scleral lens wear. So understanding that there is a new skill, there will be a steep learning curve, and then working through that with the patient will always be helpful. In terms of adaptation period, it's important to understand that we want to slowly graduate our patients into the full-time wear schedule. So normally in the clinic, I'll start them with 4 hours of like contact lens wear and then slowly build on it like by 2 hours so that that way they're getting more comfortable with the contact lens wear. And lastly, detailed instructions on contact lens care as well as maintenance, just to make sure that we minimize the risk of microbial contamination and infections for the patient. So when we talk about scleral lens, we already know that there's a lot of different moving parts. A lot goes into the process of learning application and removal. We are looking at different solutions for disinfection. We're looking at preservative-free saline. And then there's the whole component of the tools that go for application and removal. So breaking it down for the patient through different resources can simplify the process and can make it easier for them to understand how the fit or how that training session will go. Lastly, the last step of that journey for the patient is the follow-up. So here we are kind of training, or we are discussing the future assessments that will be done on an ongoing basis. There's those resources that are being provided for continued support. And lastly, it's the education component about that the lens is managing their the vision or the surface, but there's more that goes into, for instance, when we're talking about patients with keratoconus, the annual monitoring with topography, the annual routine checks, they're still very crucial. And then when you're looking at patients with ocular surface disease, yes, the lens is covering that cornea and is protecting and providing lubrication to the corneal structure, but then there's also other therapies that still need to continue with to ensure that the corneal health is optimized. So how can we use, in the process of working with our patients and in the process of optimizing their journey, how do we incorporate our team in the whole mix? So a couple of things that I've extensively worked on is building strong training sessions for the clinic. One of them is providing lectures. Then there's the workshops, and then SOPs, which are the standard operating procedures for the clinic. So in the lecture, normally anytime we hire or we recruit a new staff, the first thing that after they're trained with the EMR and the basics, they go into the specialty contact lens lecture. So here we are talking about an overview of different contact lenses that we fit in the clinic. We'll talk about the different specialty options and the terminology for the lens. It kind of eases the staff when they are answering the phone calls to understand what the patient means, especially if they were to get a call about a suction cup. Some people would not understand what that means in a contact lens term. So breaking down the terminology is always important. Then they'll work with the Scleral lens tools. We'll do a session of application removal training in clinic so that everyone understands what the process looks like for the patient. We'll give a brief overview discussion about the fitting process for the patient, how the lens modifications are made, and what the wait times are in between for us to kind of receive the contact lens from the companies. Then we'll provide a brief overview of the technologies that we can have in the clinic that we can optimize the care for the patient. And then just a list of common concerns that have arisen in the past that the staff can kind of learn from. So this will form our normal gist for lecture that is being provided to the staff as soon as they're recruited. The other thing is workshops. So the workshops are done quite frequently or initially, and then as the staff is trained and well equipped, then we kind of taper down on the trainings. But essentially in the workshops, we'll sometimes have a corneal lens workshop or a scleral lens workshop or a hybrid. So over here, we are teaching our staff members to kind of apply and remove the contact lens. It's always important if they can touch and feel the contact lens and they can perform the skill, it becomes more easier for them to train the patients when they are coming in for their training sessions. And lastly, the standard operating procedures. So this is one of the parts that I'm more passionate about. Like initially when we kind of designed our clinic, this is where I spent majority of our time in terms of honing in to the SOPs that we designed for our clinic. So there's extensive detailed instructions about how to book an appointment, what are the things that we need, the details prior to booking an appointment. If a patient is being referred, we need their eye exam, the eye exam that was performed within the 6 months or a year before we can start with the consultation. And then we'll also, in the SOPs, we'll detail what the overview of the fitting process is. So the staff has a clear understanding of how the fitting will take place, the time commitment in terms of the lens modifications, the lab times for turnaround, It will have scripts about how to kind of conduct the phone call with the patients. It has extensive templates along the patient journey of how we need to target and provide information to the patient. And lastly, it has a list of FAQs that the staff can go through, and that these are commonly asked questions that the patients have had previously. And if they were to get a call that they're triaging, they can at least refer to this document and get their answers much more quicker. In terms of email templates, we've kind of designed emails that are at different journey points of the patient. So after the consult, we have an email that kind of goes to the patient, and we are going to go into more detail about this in just a few couple of slides. Then if the patient is ready to proceed with the fitting, there will be two sets of email. If they're ready, there's a summary email that we send with the video and the homeworks. And then if they're not and they want more time, then there's a summary email that goes out to the patient of what the discussion was at the consult. After the first dispense, there's another set of email that goes to the patient that discusses the products and the cure. And lastly, at the completion, there's another email that goes with the cure and the hygiene and all the products that are used. Some of the emails will be repetitive, but that's a conscious effort of creating redundancy in the process so that we can reinforce that information at multiple different points. So the common FAQs, one of the good resources that I found when I was researching the protocols for my clinic was the Scleral Education Society website. So they have a very extensive list of FAQs that we kind of started with, and then we've kind of added more to it as the questions have arisen in the clinic. So it's almost a live document that's continuously built on, and is now a very good summary for anyone who enters the clinic in terms of fronting the questions with the patients. So it's quite important in terms of the staff in having those clear roles demarcated on the day of like your fittings that is happening. First, reception, this main task will be having that appointment scheduling, collecting all that information prior to booking the appointment. We have the optometry assistants that will help on the day of the consult with pre-testing, the training sessions for the patients. Then the optometrist will have the role of fitting as well as ongoing management. And lastly, we have always, as well as the reception staff that can kind of have work hand in hand with providing ongoing support. And if they need more information, they can get it from the doctor as well. So how do we put all that information that we've discussed into practice? So again, the next set of slides, these are things that I've implemented in my clinic. They're quite detailed. So pick as much as you would like from the few slides that we're going to go over now. So step one is the stage when you get a phone call or a referral for a scleral lens fitting. So normally the staff will respond to the referral. The task is mainly to first get appropriate information to book the appointment, and then provide the patient with the overview of the process, and especially time commitment. So some of the patients who are traveling far away to come for the scleral lens fitting, I prefer if the staff has that open and honest conversation at the inquiry stage, informing the patient about the time commitment that is required in the scleral lens fitting. There will be that multiple modifications that will happen before the fit is optimized to the patient. And then we get into the scheduling phase. So at this point, once the appointment has been scheduled, an email goes out to the patient in terms of having all the booking details, what they can expect at the consult. There will be any pending items. For instance, if you're waiting on their chart from their optometrist, that will be bolded and highlighted. So that way we know that that's a pending item prior to the consult, so we can receive it. It will also focus on the clinic policies in terms of the fitting process, the cancellation, and all the policies that you may have in your clinic. And then insurance coverage. In Canada, we normally don't bill to the insurance for the scleral lens fittings. So we will actually provide that disclaimer in the email so the patient's aware, so that we'll provide them with the invoice and they can use their health spending account or their insurance to bill for that service. And lastly, the consultation fee will be listed in that email. So there's full transparency and the patients have access to that email. Step two is when the patient comes in for consult. At that point, we know that the optometry assistant will perform the pre-testing prior to being seen by the patient being seen. During the consultation with the doctor, there will be the assessment of the condition. There will be lens selection and candidacy. And then lastly, we'll address any patient concerns. The last thing that we work on, if the patient is on the go and they want to go ahead with the fitting, at that point, we'll start with the preparation. So when we are applying the contact lens, it gives you a good sense of how the training session will be for the patient. If it's very easy to apply the lens and remove the lens, you know that the process will be much easier. They've already had a history of contact lens, so there will be less reflexes or less concerns at the fitting process. However, in patients who are a first-time contact lens wearer who've never worn contact lenses, there are a couple of homework assignments that I'll provide to the patient so that they're prepared even before they come in for their first dispense. So one of the assignments that we'll have in our email is drop installation, especially for patients who've had a hard time during the consult for holding their lids and just keeping their eyes open. So during this homework, the main task is that when they go home, they have to open their eyes, they have to try and open their lids as close to the lid margin, and then practice putting an eye drop in their eye with their eye open. So that way they can get much better and they can minimize those reflexes of squeezing the eye shut when something comes close to the eye. The second thing that we'll send is a link of the video of application and removal. So this is a really good resource. This video actually covers two different ways of applying and removing the lens. It covers the tripod method as well as it covers the suction cup. A lot of times when the patients come back, it's so much more easier for them to understand what the process would look like, which hand to kind of use for the suction cup, how to kind of hold the lid. So it's just that ease that comes when they have visually seen the skill being performed by someone else. And then that kind of eases them into the training session when they're performing the skill themselves. So in the email that we send at the consult visit, we'll have the summary of the options discussed and what the recommended course of therapy is basically targeted for the patient. It will also cover the cost of the treatment that we have recommended. It'll have the scanned copy of the consent form so that they can peruse through this consent form at a later time as well. And it will have the reading materials like any articles about scleral lenses, or we'll give them the homework videos as well. So in this particular email, we've not only provided them more reading and writing tools, which is the consent form that they can refer to for just understanding the fitting process. We provided them more of a visual feedback in terms of the videos. And then they also have that discussion point of like making notes through the videos, and then bringing, if they have any concerns that come up, they can bring it to the next dispense visit. So step 3 is our time when we're actually doing our dispense. So this is when the patient comes in, we're training them on applying and removing contact lenses. So this is where the hands-on training happens for the patient. In addition, now we are working on educating the patient on a newer skill, which is how do we disinfect the lens, the case, as well as the suction cups, that all the things that kind of go into the scleral lens application and removal. So in this particular case, the one thing I've actually noticed in clinic is people will always they'll be aware that they have to clean their lens every day. They'll be aware that they have to clean, like they should throughout their cases. But the issue comes when we talk about the applicators. So that's when the patients don't realize that that needs to be cleaned as part of their daily regimen. So one of the videos that we kind of made in clinic that we'll pass on to patients or they have access to is how to use your ClearCare system to clean your suction cups. So over here, as we know in the ClearCare system, there is that chamber in which the lenses are stored, and then there's the neutralizing disc at the bottom. So we normally will break off the little chamber where the lens is held, and we'll maintain that neutralizing disc in the case. We'll fill it up with ClearCare, and then we'll soak our solution. So I'm just going to play this video so you can take a look. So here, the chamber will be broken. So just the neutralizing disc goes in there. We fill it up with peroxide, and then the suction cups are stored in there. So this is one of the resources that we'll send to the patient so they understand that the lenses get cleaned every single day with the recommended solution. Their cases are being replaced monthly, and then their suction cups are being cleaned so we can minimize the risk of microbial contamination. The next thing that we provide on the day of dispense is a binder. So they will have like written resources that they can also read through. Some people prefer to have more paper just so that they can kind of read through at their own time instead of digital copies. So they'll have a hygiene sheet of the do's and don'ts with the contact lenses. It'll go over their lens care essentials, as well as it'll talk about different types of solutions that are recommended, different saline that they can use. And it will have the written down instructions of how to apply and remove the contact lenses so that they can read those instructions, as well as they have the resource of watching that video in tandem. So in terms of our starter kit, we'll have like all the necessary things for them to get started with the contact lens. It'll have the saline solution, the DMV suction cups, the Boston Simplest, and we'll throw in a few cases. So that way they know that this is all what goes into the lens like application removal, so that they can get much better prepared at their own time as well. And they can go and buy more products in comparison to what we've given them in the clinic. In terms of the remover, like the application removal tools, there's a wide range of different products that we have available. And this is where we have to look at different stages at what the dexterity of the patient is and what is the different like system that we would recommend for them. A patient who has more difficulty in terms of maybe like holding their lids while applying the contact lens, we can probably like give them a Dolce apparatus or recommend that particular system where they're focusing on holding their lids while that suction cup is stable, and they can just like target their eye towards the light source. So just working with the patients, assessing the skill level, and then making recommendations based on what will work best for them can be very, very useful in optimizing that experience for the patient. In addition, we'll always provide them links where they can actually purchase the products. So like Dry Eye Shop, Amazon, or if you have like your own e-commerce website as part of your clinic, you can always create profiles and link the products that you've recommended for the patient so that there's less confusion as to what products they should buy. Normally, when we are talking about in the email, like we'll have the videos again, we'll link the videos. It is the second stage where we'll be more repetitive and we'll tag the link again so that they can continue to watch and continue to improve on their skill level. And in terms of the recommended products, now when we are offering or when we're suggesting disinfection products, I always like to give them two options for the product. So if one of the products becomes backorder, like I know in Canada in the past, there was a solution that became backorder, so that they have a reference to a second product that they can use if one was being discontinued or was not available. And similarly for preservative-free saline, there's always two different options that are provided to the patient so that we're not bogging them down with multiple options, but at least at the same time, keeping it succinct to have backups for them. And lastly, we'll also go into compatible ocular surface disease care products. For instance, if the patient also has to use ointments or they have to use lubrication drops, we'll recommend the products that are more compatible for the lenses. Lastly, we'll provide more detailed instructions in the email about hygiene as well as replacement schedule. And in terms of hygiene, we're discussing all the different cautions about do not sleep, do not nap, no swimming, no showering, just so that the patient's aware. In the clinic, we'll break it down. However, we'll also provide those written instructions that they can kind of memorize or retain that information at a later date. The last step, or actually a step before the last step, is your fit completion. So here we are discussing the future follow-up schedule for the patient. After the fit is done, we still need those ongoing assessments of the fit because the cornea can change. There can be changes to the fit, so the adjustments need to be done as needed. We'll discuss the care of the lenses in long term. How can they take best care of their lens? How do they disinfect their all the tools really well to prevent or reduce the risk of microbial contamination. And then we'll talk about the different products and different options for the different products that they can use as for their disinfection or saline solutions. Here, this email is again one of those repetitive emails in comparison to the second one, where we are still providing similar information in terms of the tools, the care, the hygiene, as well as the link for resources where they can kind of purchase the products online or at different like over-the-counter pharmacies. And lastly is the ongoing care. So this is one of the important steps. After the scleral lens fitting has been done, setting realistic expectations in terms of that ongoing care with care for keratoconus, as well as the ocular surface disease, still needs to be managed on an ongoing basis. So the routine eye exams need to be done, not just to monitor the front, but also the back of the eye and provide that comprehensive care to the patients. And lastly, at this stage, we can also utilize our staff in terms of having those FAQs if the patients were to call back and to ask questions about their lenses, their plungers, or different types of solutions. So having that staff preparation and documents so that they can rely on those and get that feedback to the patient appropriately in a time-efficient manner is very, very important. This is normally the last email that goes after the fit, which is again discussing the disinfection process in detail. It also covers your care that we've discussed previously as well. And then the last piece of information that we'll have that will be slightly different from the others will be the breakage and the warranty for the lenses, so that they're aware of what the warranties kind of look like for the contact lenses. So just in summary, like when we are working in clinic, we can use our, not just the clinicals like operating procedures, we can use our staff to the best and the maximal ability so that we can provide as a team, we can provide the best possible care to the patients. In order for us to do that, having clear protocols always helps. If you can create a standardized approach by which we are addressing concerns so that there's consistent and similar information that is going to the patient, will result in less confusion and will result in better outcomes. So having those SOPs, like whether in the form of like instructions of how to book the appointments or those email templates or consent forms that are already built, that are always a good resource, not just for the patients, but also for the staff when we are training them. The next step is like having those training and development sessions, whether it be form of lectures, whether it be in the form of workshops, and then ongoing meetings where we're discussing the latest technologies that have been come out with scleral lenses or other contact lenses is important in continuously updating that skill. And lastly, it's important for us to empower our staff and then provide them the knowledge base so that they can address the concerns that the patients might bring to them much more in a more confident manner, and they can provide that personalized support as needed.